But it was really important for me to have the story about inspiration and empowerment and not about the sadness. And I think that's what's a little different about it, is that, we're really talking about we couldn't change the outcome for Ben. And that's not what necessarily we're trying to do, but we're really bringing out these things that people can do to enhance what they're going through. And that's what I think is a little different and cool about what we're talking about. Harder to describe, and sometimes harder to fundraise for, at least right now. But yeah, it's a good story. Well, I did it as a kid and I always loved it. I just was a little too tall to make it as a career, so it stopped. And then, when I was getting divorced when I was 40, I just really felt called to go back. And then again, 10 years later, when life shifts, I just keep going back to it. I got to see Ben's journey as through the lens of a caregiver, but I was also diagnosed in 2021 with a stage 4 rare cancer and found myself in the seat of a patient. And I could not help but think about the things that we did for Ben and the way we navigated that. And that was kind of my, it worked. The way we were able to normalize the situation, to look for resources to help us, became a quest that I very quickly took on too. So I think it's not being consumed with an illness, not being defined by what that is, but to continue to live. And, if Ben could do it, I could do it, as part of this study. Because we really got to look not only at the warm and fuzzy effects of, making your journey a little easy with the healing arts, but also the financial impact of these therapies. Or when someone engages in these therapies, is it shortening their doctor visits? Is it cutting down patients going to the emergency room? All of these other things that really come into a place. So that's where, we've got it down to these two segments. It's premenopausal breast and head and neck, which typically is a hard population to serve.
Out of all tumor types, head and neck cancer patients tend to have the most tend to be the most affected by different sort of mental health, like depression, related to their diagnosis, depression, anxiety, different psychosocial factors.
The foundation has evolved over the years. We first began talking about integrated medicine. And as I learn and as I brought on a medical advisor, and I learned so much from her when she speaks, but, there's something called the healing arts, which we have now started using in substitution. And I think the healing arts, it encompasses so much more. The healing arts encompass spirituality, encompass music, dance, nature, chiropractic, an array of things.
I think back to even when I was in medical school training, there was a lot of skepticism about the healing arts and integrative modalities of therapies. It wasn't really seen as an important part of patient care or health and well-being. But we know now that there is a wealth of evidence, data, and research supporting the impact that these practices have on clinical outcomes and patient care.
So if we start introducing things like yoga for relaxation and coping and stress management in the hospital, then we're planting that seed and we're helping to teach them about once they leave the hospital, what are some resources that are available to them in the community? And so it's our first step in that social prescribing. So it's so cool that with our department, the administration here and the Ben Goldberg Foundation and Wendy, of course, were able to leverage some of that with the services that are provided.
I remember I was on the floor just making the rounds, and I kind of stopped in the hallway and I thought, this is the void. I had not fully started the foundation yet. I knew I wanted to do something to honor Ben, but I thought we could bring some of these therapists here to CHKD, and that's what we've done. And so to walk back through here, 8 years it's been since Ben passed, and to know that we've made such an impact. So the families that walk through these doors now will have access to things that Ben didn't have access to, and that just warms my heart.
I think in the future it would be super cool if, as a profession, we had the ability through insurance companies to become reimbursable. I think when we look at the importance of moving your body and utilizing nature or resources around us, we could really do so much teaching and education with families that the moving of the body could then potentially lead to better lifestyle and fewer doctor's visits. That's ultimately what I would love to see.
So often in our healthcare system, as physicians, we are either asking our patients to eliminate certain activities from their lifestyle or their diet, or we're asking them to take a medication to treat their condition. But with social prescribing as a model, we're able to actually provide a direct referral pathway to patients. So it's not just here's a prescription to go get more exercise or here's a prescription to take an art class, but here's a prescription and this is exactly where you can go to fill this prescription to actually engage in that exercise, to actually engage in that art activity. Social prescribing originated in the UK in response to the strain on the healthcare system. When they implemented a social prescribing pilot project within 1 year, those non-medical social GP, general practitioner visits, decreased by more than 50%.
So the intervention that we're looking at in the study is offering patients one of two social prescribing options. One of them is a group MOVA visit, so a group visit to the museum. And then the other one, and this is because when I did my literature search, there's a lot about music and head and neck cancer patients. So we already know there's already research and data that it's helpful. And so the second option would be group music therapy.
Hello.
Hi, everyone.
How's it going?
Good. Welcome.
Thank you.
I'm going to test my screen share here real quick. Can you guys see that? Okay, cool.
Yep.
I'm going to stop it for now, but I just wanted to make sure.
Part of this social prescribing is that these are events that people are engaging with others. So I do think having some sort of group element or aspect to it, maybe the entire event doesn't necessarily have to be, a full hour-long facilitated group aspect, but there's a portion of it.
I think logistically for us at the museum, having a kind of facilitated experience available for this population would be easy to make happen if it was sort of scheduled out ahead of time.
Yeah.
It could also foster a good sense of community for them to have maybe they're coming with a family member, but maybe they also are getting to know other patients who are coming to the same experience multiple times.
Exactly. And, because if you also think about it with the group music therapy sessions, right, those are going to be group, those are going to be facilitated, right? So I want as many similarities in terms of the structure and format. I think, again, just to keep this study clear.
One of our taglines is to transform the healthcare experience through the arts. And that's what we're doing when we talk about the healing arts. And in the future, I would love to see this further integrated. I would love to see a more holistic look. I think he would be very proud of the work that we've done. And someone asked me, how do you pick the programs, or how do you decide what the foundation is going to do? And it's very simple. I have to think back, because there's a lot of things that we can do, or there's a lot of directions we could go in. But I always ask myself, is this something that would have helped Ben?